Okay, thank you. So Infoway, we do mobilize Canadian stakeholders through the healthcare system towards a reimagined future. At Canada Health Infoway, we want to ensure as a vision that all Canadians have equitable access to excellent healthcare and health information. And we do believe that a more connected and collaborative system is a healthier system. So the mission of Infoway is to bring a pan-Canadian focus to improving the patient experience, improving the health of population, and unlocking the value for the health system overall. So the Infoway focus is on different folds. So we do have different pillars that we're working towards. One of those is prescribe it, excellence, and adoption. And we also have work to do around Canadian interoperability across the different jurisdictions and health system. So Prescribe It is an electronic prescribing service that provides safer and more effective management, medication management. And I will be talking about that a little bit further into the presentation. And the interoperability is really the capacity of systems to exchange data in such a way that it is structured and it is understood from the receiver to the recipient in a common format and in a way that information is not lost into the message or into the exchange. So at Infoway, as you can see at the bottom of this slide, there's different department and programs that are supporting these different pillars that I just talked about. We do partner and do have collaborations with different stakeholders and organizations in Canada. So we do partner with governments, provinces, territories, jurisdictions, healthcare organizations, the vendors, industries, clinicians, and patients. And here, just high-level metrics about the benefits from Infoway's digital health investments, since we have been working in enhancing and in implementing the electronic health records in Canada. So there's an estimated of $43 billion in benefits into the healthcare system in Canada in connection of information that is being exchanged between the different stakeholders, point of care systems, and also virtual care. So now about the health standards team at Canada Health Infoway. This is a little organigram that explains who we are as a team. So we do have a director, Interoperability Standards Director. We do also have 3 managers, one for SNOMED City, Standards and Operation, and one for Fire and Technical Interoperability. There's 3.5 full-time employees that are part of the standards specialist group. So 1 specialist for SNOMED City, 1 for PCLOD, 1 for HL7. We also have part-time collaborators or experts. 2 of those are translation experts, and we also have 2 part-time clinical experts, mainly involved into the SNOMED City portfolio. So the standard services that Infoway is providing, one of those is related to the National Release Center, which is a one-stop shop for Canadian for anything that is related to standards in Canada. So Infoway is the National Release Center for clinical vocabulary, such as SNOMED City, PCLOD in Canada. And as you can see here, we also have other standards that we host and we publish through our platforms. So Infoway is also an affiliate license holder for both HL7 Canada and IHE Canada. We provide secretariat support for ISO TC 215 community in partnership with the SCC. And Infoway is also a voting member for Canada onto the international DICOM ballots. And we are a member of DICOM Working Group 6 to help inform Canadians' requirements for the base DICOM standards. So the direct services we offer to Canadians are related to standards development content, and we'll see that in more detail in the couple of slides coming. We also offer services around licensing and distribution, and we also are SDO affiliates, and we support secretariat support for and ballots for HL7, DICOM, I3 Canada, and ISO TC215. So on this slide here, you can see that we have a couple of tools that we are using for standard development content. So one of those is INFORMS, which is the acronym for Infoway Request Management Solution, which is a tool that you can use to submit or request change into the terminology, such as SNOMED CT, NP-CLOT, or LOINC. Also to subsets. So if there's any changes to existing subset, you can submit a request. Or if you want to see a new subset to be created, that's the tool to submit your request to. We also have from the Informs platform some dashboards that we have created to support different use cases. As you can see on the right side of the screen here, we do have dashboard for the release content for each of the releases that we publish. So one of those being SNOMED CT, where you can see the number of requests for change that we have received, those that are pending to be done, and those that have been completed. We also have created other dashboards to meet other use cases or requirements, one of those being COVID-19, where you can see all of the requests that were submitted to us, either from SNOMED, from the subset perspective, or by from the PCLOT perspective. So all of that is documented into the dashboard. We also have a tool that we use for authoring SNOMED CT, which is TermSpace, a collaborative terminology authoring tool that we're currently using, as I said, to author Canadian-specific content for SNOMED CT. And we're hoping to eventually open that tool to stakeholders so that we can collaborate better onto a more founded, if you will, Canadian extension edition of SNOMED CT. From the licensing and distribution perspective, Infoway provides convenient access to a wide range of licensed and proprietary material. And to ensure compliance with our various agreements, Infoway account users are asked to confirm each year the license and acceptance of the license agreement on a yearly basis. So this is usually done end of March each year. And what this does is that it's allowing the members of InfoCentral to access standards themselves and also all related material. So related material may be webinars, maybe documentation, maybe references, and so on. So that's all part of the agreement and access to the InfoCentral hub that I will be talking a bit more in a couple of slides. So for distribution, we use currently the Terminology Gateway. That's a tool that was developed in-house at Infoway. And this tool is publishing the different terminology artifacts that are being in use either in a pan-Canadian manner or for jurisdiction. So Terminology Gateway currently hosts pan-Canadian subsets. It does host the standards file for PCLOT, SNOMED CT, Prescribe It. And we also have a space where we publish jurisdictional artifacts when that is required, so that jurisdiction or organization don't have to have such a tool. They can provide us the terminology artifacts, and then we can publish them so that they are publicly available for anyone that would want to leverage them. The terminology gateway allows also to export those artifacts in different formats. One of those formats is APIs, and you can see here on the screen that there's terminology APIs as well as FHIR APIs, as well as other format like not HL7, but XML, JSON, Excel files as well. You will find also some links to existing browsers that have been already developed by other organizations. One of those is SNOMED International, where you can browse the Canadian content through SNOMED International browser, either from the daily build perspective, so anything that is currently being developed and not published yet, but also from the real published browser from SNOMED International. Again, you can find there the Canadian edition of SNOMED CT in that browser as well. So the services to the community of practice that we offer are education and training, webinars, collaboration groups, community of practice, and we also support different projects or different programs through communication, promotion, and social media. So InfoCentral is for us a collaboration hub where you're going to find different working groups. At the moment on the screen, you can see that we have the little icons for specific working groups, like sex and gender organism, that is a new working group. French translation, also a new working group for any SNOMED CT translation that is happening currently. Patient summary, social determinants of health as well, you can see here. And there's more than that. So what you need to do, if you're interested in any of those working groups, you can join them, and then you can collaborate and have some discussions around different topics of interest. The same for communities. There are several communities that you can join. Same thing, so you join them and then you can collaborate and have interesting discussions on implementation, use cases, requirements, use cases for implementations, and so on. From the InfoCentral Collaboration Hub, you also have access, as I said earlier, to the standards and related documentation. And I'm showing here some of the pages that you can find on there for SNOMED CT content, as well as for pCloud content. For the education, not only at Infoway will you find some interesting webinars, material, and links, but there's also international SDOs that publish their own material that is a very good source of reference. So SNOMED International, Regenstrief Institute, and HL7 International do have also educational material that is available for you if need be. There's also ongoing Infoway webinars. University of Victoria, as you're well aware, have plenty of material and references. Same for CHIMA. And we also, as part of the ongoing education for and from Infoway, offer training and refresher on different topics of interest for our community. Often the case, we offer webinars on tooling, standards, requests for change, and so on. Couple of metrics here for the number of the work or activities that we have been involved into for 2021, 2022. So as you can see here, more than 2,300 Canadian updates were made to the international clinical vocabulary, both in French and English. There's more than 40 FHIR projects that are available onto the Canadian FHIR registry. So there's a lot of action and mighty projects there that are available for anyone that are interested. Also, more than 140 standards releases that include SNOMED CT, e-prescribing, immunization, microorganisms, and pCloud. And we have answered more than 1,300 requests for help, support, guidance to our help desk. So now the next section is on health terminology standards. high-level information related to PCLOD, which is the pan-Canadian constraint of Laboratory LOINC in Canada. So this is supported and published through the National Release Center from Infoway. And it is the largest laboratory terminology in the world, both available in English and French, and also has a linkage or does have information related to UCUM, which is the recommended unit of measure. This standard is published twice a year in January and July each year. Here a couple of information. So last release, March 2022 release, more than 38,000 total records were part of the publication, where we saw new records of 136 and modified records to the total of a total of 184. Both English and French were added there as well. From SNOMED CT perspective, so we do have a Canadian edition that we publish, again, through the National Release Center. This is the largest clinical reference terminology in the world. It is available in both English and French, and it is released twice a year at the end of March and at the end of September currently. A couple of metrics on English content. So we have received to be part of this March release more than 600 requests for change, where into those requests we have created more than 135 new concepts. We also included into the version 3 new subsets to augment the offer for data capture into implementations. Out of these 600 requests for change, 200 plus were submitted to SNOMED International for promotion. And we also saw into the new content, 16 new concepts related to COVID-19. From the French perspective, we have added, or we have a total of 167,000 concepts that were translated into the version. And where we also translated 19 COVID-19 concepts. And out of the 600 RFCs that we received, we can see that there were more than 60% that were for French translation to be added to Canadian edition. So there's a lot of translation required for implementation at this moment in Canada. So why do we use standards? So standards are being used in systems. So as you're aware, so for data capture, and you have here a couple of examples, and also to ensure that, when exchange of information is being done between different systems, we do have a common understanding of the information that is being shared. So it can also apply to lab systems as well as any information system. Sharing of information is also crucial, as I spoke earlier, or as I referred earlier to interoperability in Canada, which is one of the pillars that Infoway is focusing on. So exchange of information is crucial, and to ensure that we do that properly, we use standards, as you're aware. So we do use terminology standards as well as exchange standards. And one of the most popular exchange standard that we are using currently is the FHIR Fast Health Care Interoperability Resources is the long name for the FHIR acronym that we are also using a lot at this point in time in Canada. So what does this mean in practice? It means that we have different types of interoperability. This is a nice graph that shows how interoperability works and the dependencies, I would say, between the different layers that you may have when you start working with interoperability. So it does start with a foundation. So how do you connect to a system to ensure that you can exchange information? And then you will want to ensure that you structure the information so that you can share and exchange it within a network or with someone else. And then you will add to that the data, so the information that's going to be exchanged or shared with someone else is going to be into a format that is recognized, is standardized, and can be reused and understood between the different stakeholders that are part of the exchange of the data. So the interoperability here refers to the ability of a health information system to work together across different boundaries to provide the continuum of care for individuals and communities. It is the ability of different systems and software to communicate with each other, to exchange data, and use the information that was exchanged. So it is really important to keep into that exchange a context and ensure that we're not losing information. So that's part of the interoperability. And the meaning piece is part of the semantic interoperability, where you're entering that you're using terminology standards as well as exchange standard throughout the whole process. So if you're lacking interoperability, so if you don't have standards to support you through that journey of exchanging data, then there's poor communication that's resulting into inefficiency, duplicated efforts, and also delays. So what's important is that part of the exchange of data is, of course, crucial. And in order to determine if and when it has to be encoded, if you will, with standards, so it has to be supported or enabled by standards, it is crucial that this is being driven by clinical requirements, so that it can be effective and can be it will be meeting the clinical requirements of the healthcare system. And then it has to be supported by the technical or the exchange messaging piece of the standards. What is also to be considered throughout this exercise is the maturity level of those that are involved into the exchange of information. So here, you probably are aware of different maturity framework that are out there in the world space. I pulled out one of those, which is related to SNOMED City, but there's others as well that you can select to determine the level of maturity of the different organizations that are part of the exchange. And that is important to be considered, because if all of the organizations that are trying to share information are not at the same level, that needs to be considered into the project. So so that is a piece of work that needs to be built in to the project, and of course consideration of that needs to be also applied through the project. So in other words, implementation of standards is a journey. You probably heard that before. I probably not the first one to say that. So since the beginning of Infoway, so since 2001, Infoway does promote interoperability. It has evolved with time, but we're still promoting exchange of information, and now we're trying to be more effective. So in fact, what you want to do before you get into a journey is collate your requirements and then draft a plan. Ensure that you do have your maturity level information, so that you can level set it appropriately depending on who are part of the exchange into the network exchange that you're going to be working with. Then you're probably going to be defining some gaps in there into the process, either tooling, terminology, or otherwise. And then we're there, Infoway, to support you whenever you find a gap into that journey. So we can provide you, as I alluded to earlier, through the tooling and the reference and the material we have, support, guidance, information, best practice, and of course, real concrete files, material that can be leveraged for your implementation and the journey that you are going through, so that at the end you're successful, and then you can effectively share information that is effective, so you can connect between different systems, but also be semantically interoperable between the different systems with the exchange of information, data that is standardized and that is following, again, best practice. So a couple of examples I wanted to provide you with is Prescribeit, which is a national not-for-profit e-prescribing service that provides safer and more effective medication management. So this is a tool a software that was developed, and this is for the whole country. It's quite successful. It does encompass the technical piece, but also the terminological piece as well. So it does improve medication safety. There's less loss of prescription. Of course, it's all sent electronically. It does offer secure messaging, and it does offer also new opportunities for renewals and better control of medication and dispensation that we didn't have when it was not in electronic format. So the data piece, or the vocabulary piece, is done through the Canadian Clinical data set, which is in fact a terminology that is binded with the Prescribeit tool, which is offering a common vocabulary amongst the different stakeholders that are using this service. We also have the patient summary Canadian specification that is based onto the International Patient Summary IPS specification. And Attila Farkas will talk about it later today into one of the mini conferences that will follow. So patient summary is a health record extract at point in time that does encompass standardized collection of clinical and contextual information that informs the patient's treatment at point of care. So this is being developed at this moment, and it's still evolving. And again, Attila is going to talk about it later. It will allow sharing information, different organizations, sharing of patient summaries across different solutions. And that has been established as being a high priority for Canada to be done. So that's why we're working on that. This summary, Canadian summary, will include allergies and intolerance, problem list, immunization, history of procedures, medication summary, vital signs, past history of illness, and social history. It comes with a content data model, and this is to address and meet the requirements of the variances that have been found into each jurisdiction or any organization that is going to be wanting to use the PSCA in Canada. So it will be using different standards to support jurisdictions in their journey, value sets, and jurisdictionals and other artifacts. So basically standards like SNOMED CT, Canadian Edition, PCLOD, LOINC, and Canadian value sets and others will be used into this specification. So this is providing you with a map with the different projects that I just spoke about. There's also the ODT project, Organ Donation Transplant project, that I didn't talk about, but due to time constraint, you can invite me for a next presentation, perhaps on that topic. But this is also really important for Canada to be developed, and there's current work on that front at this moment. The map that I present today does not also include all of the implementations that are going on through in a pan-Canadian manner, so through Canada. So either from the request for change we receive or other projects, there are projects everywhere related to implementation of SNOMED CT, PCLOCD, LOINC, and others, again, in Canada. So what's on the horizon? A lot of things. So one of the most important pillar for us is virtual care in Canada. And we have a lot that we've started, but a lot to achieve still. And again, into a next presentation, Abby Kalra will be talking about partnerships and governance. But this is something that needs to be strengthened going forward. We, with the different project and program that we have started to work on, we are acknowledging that there is some enhancements that needs to be done to the data model and information. So we want to strengthen that data and information model. There will be some work around the health standards governance, partnerships, system integrations, and collaboration. And as I've alluded to earlier, we need to improve interoperability in Canada. It's starting with the patient summary Canadian specification, but we're hoping to pursue with that project and most probably with other projects as well. So how can you get involved into these projects or into the discussion? So you can create yourself an account onto InfoCentral. As I mentioned earlier, this is a collaboration hub for accessing material and collaborating with other stakeholders in Canada. There's also all of the usual channel for communication, get information, get your voice heard as well. So from Facebook, Twitter, LinkedIn, and YouTube. And there's also different artifacts that are being published from Infoway communication group. One of those is the Digital Health Dispatch, and then you can subscribe to get any new publication, and so that you are keeping yourself aware of any new things that we do, good projects that are being kicked in, and any new discussions that are of interest for you. And I didn't put it here, but any committees, working groups that you're interested to collaborate into, you can join them as well. So that's always a good place to get information from. And so the quick links to get access to InfoCentral, Prescribe It, virtual care information, the organ donation transplantation project that I alluded to earlier, and the health terminologies community as well. And that's the time for questions.
Hi, Linda. This is Francis here.